Dear colleagues, since my last video 3 weeks ago, things have changed significantly. We now have more than 50 cases in Kazakhstan, and 2 of our biggest cities are now under quarantine.
Let's panic!
That's not a good idea, Maxim. But we do need to step up our efforts. Here's why. Over the last 2 weeks, we have seen imported cases in Nur Sultan and Almaty. These are people who acquired the virus in other countries and brought it back as they returned to Kazakhstan. Authorities are doing their best to identify and isolate these cases. When they are isolated, they will not infect others. But identifying them are not always easy. Some of the infected people may have very mild symptoms. They may ignore their symptoms and they travel, gather, or come to work.
They should not do that.
So the cases can spread to become local clusters. These local clusters can further spread into the community. As the disease spreads, the number of people who become infected increases. After getting the infection, people will become immune. As more people become immune, the number of new infections will naturally go down. So what is the problem? The problem is speed. Although most people will only experience mild symptoms, some may experience severe symptoms like breathlessness, and they may need to be treated in hospital. If people in this category get sick all at the same time, then our hospitals can be overwhelmed. We will not have enough equipment and doctors to make sure everyone gets a good treatment. And as a result, the number of deaths will be high. So is there another way? If we can slow down the progression, the rise in the number of infections will be slower, and the peak will happen later. A lower peak means that our hospitals will not be overwhelmed, and our doctors and nurses can save more people. A later peak means that our hospitals have more time to prepare, like getting more medical devices, more medicines, and more personal protective equipment. How do we achieve that? By preventing ourselves and others from getting infected. Just like in our last video, wash your hands with soap and water frequently. Avoid touching your eyes, nose, and mouth. Cover your cough. And most importantly, if you have fever or a persistent cough, you must stay at home. In addition, we now need to work together to implement our social distancing policy. This means no more large gatherings. We avoid face-to-face meeting unless there are no other options. Instead, we use Skype. Where possible, we work from home by following our working from home guidelines. We close non-essential places where people may gather. If we have to meet, we maintain a distance of 1 meter from each other, and we now greet each other without contact.
Сәлеметсіз бе?
Привет.
Ассалаумалейкум. Ассалаумалейкум.
Добрый день.
Social distancing is not easy. It requires a lot of sacrifice from all of us. But if we start to do it now, we will save thousands of lives in Kazakhstan. Some of those people we save may be our family, relatives, or friends. In addition to the virus, fear is also our enemy. Fear can lead us to panic, and fear can also make us do things that cause a lot of harm, like spreading rumors or blaming certain people for the outbreak. Instead, we must remain calm and focus on doing our part. Together, we can defeat this virus. Thank you.